Welcome. This is Medicine with Dr. Moran. I'm Dr. Keith Moran. I've made this video today about how to prepare for your doctor's visit when you have congestive heart failure. It's all about congestive heart failure monitoring. It's important to be prepared for your visit by compiling relevant information that you and your physician can review at the time of your doctor's visit. So let's get started. This is a list of the data that you should bring to your appointment. This includes your weight readings, the blood pressure and pulse readings that you take, symptoms that you might have, particularly shortness of breath or ankle swelling, your medication list, which is kept updated, and blood glucose readings if you are diabetic. I am now going to go through each one of these to further elaborate. First of all, your weight. You should weigh yourself every day, ideally with no clothes on at the same time of the day. Record the weight. It's important to look at the trend of the weight. A weight gain of more than 4 pounds or 2 kilograms suggests fluid retention and the need to increase diuretic therapy for a day or two, often in order to get your weight back down to where it was. Diuretics, which are often known as water pills, and those two words are used interchangeably, they cause frequent urination in order to remove salt, or sodium, and water from your body to resolve fluid retention. If your weight goes down too quickly, this can indicate dehydration and the need for less diuretics. Next is blood pressure and pulse. It's important that you take your blood pressure and pulse with your home blood pressure monitor on a regular basis and record the readings. If you don't have a monitor, it's something that you really should get. There is an optimal range for blood pressure and an optimal range for pulse. We like to see the blood pressure between 90 and 120 for the top number, which we call the systolic reading, and between 50 and 80 for the bottom or diastolic reading. If the blood pressure is higher than this, it means your heart has to work harder to pump the blood forward to the body. The blood pressure is the resistance that the heart has to pump against. If the blood pressure is too low, then patients can have significant dizziness or even faint, as there's not enough blood pressure to push the blood all the way up to the brain. Medication adjustments are needed for both high and low blood pressure readings. Look at your blood pressure and see whether there's a trend in the blood pressure during the day. In other words, is the blood pressure higher at certain times of the day? It's helpful to compare your morning readings to your afternoon versus your evening readings. I have a separate video on blood pressure that you might be interested in. Click the link on the screen now for that video if you are. The pulse also has an optimal range. We generally like to see this in the 55 to 65 beats per minute range. In the vast majority of cases, the pulse tells us what the heart rate is. If the pulse is too slow, medication adjustments may be needed, or if the pulse is really slow and you're not on any medication to slow it down, then a pacemaker implantation may be needed. Higher pulse rates above 65 beats per minute require medications to slow the heart down to get it back into the optimal range. The pulse can be measured manually by feeling one of your arteries. Often we use the radial artery here on the wrist, and you can count the number of beats in 15 seconds and multiply it by 4 to get the number in 1 minute. The other place you can feel is the carotid artery, which is in this region here, and you could also count that. I note that many patients have activity trackers now, Fitbits for example, that will measure the pulse for them. Some of my patients in fact have an Apple Watch, which will give them a notification if their pulse is suddenly high, and will have graphs that they can take a look at to look at the pulse. The Apple Watch in particular also gives the ability for people to take a 1-lead ECG if patients have symptoms like lightheadedness or palpitations. This ECG, in fact, is of good quality, and it shows up nicely on the iPhone. I can certainly attest to that as someone that has done that on my own. I do plan to do an upcoming brief video on this, as I frequently get questions about ECG monitoring at home with the Apple Watch. Now, some blood pressure machines do have an irregular light, which may come on when the pulse is irregular. Irregularity to the pulse, especially if the pulse suddenly is going much faster than normal, such as over 100 beats per minute, can indicate that the heart's gone out of rhythm. An ECG can be done to document this if it's the case. Sometimes we do place a cardiac monitor, which we call a Holter monitor, for 24 or 48 hours to take a look at heart rate response at rest and exercise, and to evaluate potential rhythm disturbances. Next is symptoms. The main symptoms you should monitor at home are shortness of breath as well as ankle and leg swelling. It's a good idea for you to have a sense of what gets you out of breath. We call this your functional capacity. If you are to walk on level ground, how far can you go? That's the question that we typically ask. Patients with minimal symptoms can walk briskly on level ground, but may get short of breath if they start to go up a hill. Patients with mild symptoms can walk more than 2 blocks on level ground. Patients with moderate symptoms get short of breath walking less than the 2 city blocks. Patients with severe symptoms get short of breath walking less than 20 feet, or even are short of breath at rest. Some patients are not short of breath during the day, but when they lie down at night to go to bed, they may get short of breath. Or sometimes they wake up during the night short of breath. These are important symptoms to look for. Worsening of shortness of breath indicates that your heart failure is worsening, and frequently there's a need to adjust the diuretic medication upwards. Ankle swelling should be noted and compared visit to visit, noting how high it comes up the leg from the ankles, as well as the amount of swelling. If the swelling is really significant, not only does the ankle swell outwards, but the skin may start to blister or in fact weep. An increase in swelling indicates worsening of congestive heart failure, and obviously a need to increase the diuretic therapy to get rid of the extra fluid or volume. There are, of course, other symptoms your doctor may ask you about. It's always nice to know about lightheadedness, or whether you feel as if you might faint, fatigue with exertion, chest pain, palpitations, cough or sputum production, or other symptoms we often ask about. Remember that when congestive heart failure is particularly bad and the lungs are full of fluid, there can be a lot of cough and clear sputum. Sometimes the sputum can be pink tinged and frothy. Medications. It is important that you bring a list of your medications to every physician's visit. This doesn't matter what your medical history or problems are. Keep the list in your wallet or purse, or take a photo of it and have it on your cell phone. Make sure it's always up to date. Patients sometimes see me and they bring in old lists, sometimes 2 or 3 years ago, or lists with many different changes scribbled on them or lines going through certain drugs, and it's difficult for me to interpret. You should know how much of your diuretic that you're currently taking. That's something you should know without even looking at your list. This is something that's often adjusted based on your volume status. As I mentioned before, when people are in significant heart failure with lungs that are full of fluid and swollen ankles, we say that they're volume overloaded. Alternatively, when there's no signs of fluid in the lungs or elevated heart pressures when I examine my patients, and no ankle swelling with low blood pressure and dizziness, patients are often volume deplete, which is the opposite end of the spectrum. As far as diuretics go, I always tell people to take them early in the morning because they will cause you to urinate to remove the excess fluid. If you're going out in the morning to do errands, it's quite acceptable to take the diuretic when you get home at noon or at the latest 2 p.m. I tell people that if you need to use your diuretic twice a day, it's best to take that second dose at noon or 2 p.m. If you take it later than that, you'll have urination through the night, and that's not something that you want. Many different types of medications are given for congestive heart failure, including beta blocker drugs to slow the heart rate down, and blood pressure reducing medicines to improve heart pump function, amongst other drugs. It's helpful if you know what each medication does. If you do not, please ask for clarification from your doctor. Your doctor may ask you about other things at the visit, including your glucose control if you're diabetic. Many diabetic patients do have congestive heart failure. Diabetic patients should be prepared to bring in their glucose readings for review. Diet is important with heart failure. Depending on how significant the heart failure is, we sometimes restrict salt to 1.5 grams per day and liquid to 1.5 liters per day, as it makes it much easier for us to treat your heart failure. The more salt and liquid you consume, the more volume overloaded you will become. Also, the less salt and liquid you consume, the less diuretic that you require to keep your symptoms of heart failure under good control. Diet's also important. Ideally, you should not consume any processed food. Eat a predominantly plant-based diet and restrict meat consumption to the size of a deck of cards or the palm of your hand. Sleep is important. It's ideal that patients get 7 to 9 hours of sleep every night for memory and health. A consistent bedtime and wake-up time is helpful there. Regular physical exercise is very important, even in patients with significant heart failure symptoms. It's been shown in clinical studies that cardiac rehab with exercise will improve the quality and quantity of life. Trying to get 3 to 5 hours of exercise tailored to your functional capacity is important. Cardiac rehabilitation programs have been developed to do this. I send all of my patients to cardiac rehab for this reason. In terms of alcohol, alcohol should be limited to 1 serving per day. Patients should not smoke. Blood work intermittently does need to be done, particularly when there's significant changes in the medications, especially diuretic adjustments. Blood work needs to be done to assess the kidney function and electrolytes. The diuretics that we use to manage heart failure are very potent, and they will take away potassium and magnesium and can easily volume deplete patients, putting a strain on the kidney, leading to an elevation in kidney tests. Certain other diuretics and blood pressure lowering medications can in fact increase potassium. The thing to remember is if you're sick and you have vomiting, diarrhea, it's important to hold the diuretics for days where you're sick like that and follow up very closely from your family doctor. This next slide is from the American Heart Association. It gives good guidance on when to be concerned about symptoms. At the top, the green section indicates good control of congestive heart failure if your assessment meets all of those checkboxes on the screen. In the yellow section, when there is significant increase in weight, typically more than 4 pounds or 2 kilograms, as I mentioned earlier, with an increase in shortness of breath and swelling, we typically get patients to increase their diuretic, often by 1 tablet for a day or 2, just to bring those symptoms under control, and then put the medication back to where you were before. It's important that you let your family physician know of changes in your symptoms or medications. If your symptoms are in keeping with the red box at the bottom of this slide, then it's time to come to the emergency department. I hope you enjoyed learning about how to prepare for your doctor's visit when you have congestive heart failure. It's important to monitor your heart failure symptoms on a regular basis daily. Please feel free to comment on the video. I appreciate you joining me today on Medicine with Dr. Moran. I'm Dr. Keith Moran. Get healthy and stay healthy.